Okay, so last time that we met, we went through some of the general content on the skeletal system, talking about things like functions and classifications, both macroscopic and microscopic structures. So what I'm hoping to do today is to really move on to start to review the different bones that make up the skeleton. So we're going to start with the axial skeleton. And with the axial skeleton, we'll end up seeing mainly three main regions that we'll focus on. And then I believe on the next video, we'll have a look of the appendicular skeleton. We're going to be talking about articulations, so where the bones come together to form a joint a little later. So different textbooks will offer you very different kinds of diagrams, but at large, they all share the same basic content. So some of my students have found it incredibly useful to use some diagram to follow along and perhaps even color along different bones as we review those. You all know your own learning style, but I encourage you to find a method that works for you. I have actually provided you one diagram of the major bones of the human body in supplementary materials of this class if you do not happen to have the anatomy coloring. So I wanted to start real briefly just to bring us all on a same place when we talk about skeleton. That's a word that comes from Greek language for skeletos, which really translates to a dried up body. And remember that the skeleton serves many functions as we saw in a last lecture. If we put together all of the cartilages, bones, joints, and ligaments in the body, that ends up adding up to about 30 pounds of weight on an average sized person. So a big system, important system for us to have a look at. Before we get much further with reviewing individual bones, I wanted to just quickly get us thinking about the different kinds of skeletons that we do find in the field of biology. So endoskeleton is a skeleton that's internal support for the structures, and we see that, for example, humans and many animals do have an endoskeleton. It's inside the body. On this slide, you'll see a really nice little graph from mid-1800s showing a little bit of comparative anatomy. So you remember that both animals and humans do often share similar structures, and we can learn a lot about these structures even in human, even if we're not looking at the human body. The other type of skeleton that I wanted to talk briefly about is our exoskeletons. So these are skeletons that are located outside the body or as the outermost layer of the body. And these are often made of chitin. Many invertebrates would be examples of animals that have exoskeleton. I often describe the exoskeleton to my students as they could consider if one would have a body armor of a medieval knight, and that would serve as a skeleton of an individual rather than the internal endoskeleton. But there are other types as well. Also, leaves and plants have a skeleton. What we're seeing here is an example of a vein skeleton of a leaf. The veins do contain lignin, which makes them harder to decompose by microorganisms. So we see the structure on these pictures. We also can see hydroskeleton. This is sometimes referred as a hydrostatic skeleton. And this is a flexible skeleton resulting from fluid pressure within the structures. And we see these especially in simple invertebrate organisms. And our review of different kinds of skeletons in animals finishes with the cytoskeleton. This is really the scaffolding and transport structures inside an animal cell within the cytoplasm. And this is a complex network of interlinking filaments, and on the picture on the screen, we do actually see the protein filaments in a cell highlighted on this green fluorescent color. But that's enough of getting us all situated with different kinds of skeletons, and let's really get to the big topic of our today. So there's going to be 206 bones that make up the skeleton, and we will study those, like I said, in two parts. We will start by looking at the axial skeleton, and in a later video, we'll talk through the appendicular skeleton as well. So like I said, first we will look at the axial skeleton, and again, as we go through this, if it's helpful for you, do consider pausing, coloring diagrams, making your own notes. So axial skeleton really covers three main areas of the body, and that contains 80 bones in total. So we're going to see the skull, which is made of cranium and facial bones. We're also going to see the vertebral column, which is made of cervical, thoracic, lumbar, sacrum, and coccyx. So there's few regions for us to discuss in relation to that. And finally, we'll finish off this review of the axial skeleton with the thoracic cage, the chest cavity. So before we go into individual bones, I think it's going to be useful for us to consider the axial skeleton a little bit further. And let's think of three different functions that we have for axial skeleton. So first thing that we'll end up seeing is that axial skeleton forms the longitudinal axis of the body. So in other words, running from superior to inferior, forming that superior-inferior axis. And this is particularly important for us as this axis carries the weight from the head to the feet. Other thing that we end up noticing when we think of this longitudinal axis a little bit further is that it gives a human this kind of a cylinder shape, if you have a little bit of imagination, running from the head to the feet. And many systems pass through this cylindrical-like appearance of the human body. Thing that we see as a functions of the axial skeleton has to do with the fact that it supports structures of the axial body, so the head, neck, and trunk. So it's giving us this structure, this scaffolding, this shape of the body. And finally, we're also going to see that axial skeleton helps us in terms of functions by protecting with the axial bones many vital organs. So we see, for example, brain, we see spinal cord, and we see thoracic organs enclosed within the axial skeleton's bones. So definitely an important function to consider. So we're going to go through the three main regions of the axial skeleton, and we're going to start with the skull. With the skull, what we really end up seeing is that there's two sets of bones for us to consider. We have our cranium, which encloses the brain at the cranial cavity. And we'll also seeing that there's many attachment points for muscles of the head and neck that we can locate here. And then we're going to talk about facial bones, which really give the framework of the face. And this contains also things like special sensory organs, sight, taste, smell, passageways for air and food through various openings, and attachment points again for muscles, this time muscles of the facial expressions, what would be kind of worthwhile to consider. So let's have a look of the cranial bones, and there's going to be 8 in total for us to discuss. And we're going to start with our ethmoid bone. And I was just looking if I would have happened to have one easily available, but I don't have one on my desk at the moment. So ethmoid bone really forms the part of the base and boundaries of the eye socket on both sides. And within this bone, we would end up seeing, if we look within to the inside the cranium and right above where the nose and olfactory nerves are, we will see this fristagalli structure, which divides really the top of olfactory area. This is where the meninges, the layers that surround the brain, would attach to. And the other thing that we're going to end up seeing within this region is the cribriform plates, which are actually the openings within the bone through which the olfactory nerves enter from our cranial cavity to the nasal cavity. So if you ever get a chance to look at a skull that has been cut in half horizontally and look within to the cranium, those would be two things that I would eye out for. A few other bones that I do want to cover in relation to that, and I do have an example of here from a disarticulated skull. So we're going to talk about the frontal bone next. And frontal bone obviously forms the covering of the most of the anterior surface of the skull. So an important bone for us to consider. And as I'm looking around, I also find on my desk an occipital bone. And this is located at the very back, posterior part of the skull. And we would end up seeing that a lambdoid suture separates the occipital from the temporal bone. So that's an important suture for us to be aware. And here is what the occipital bone would look alone that's being disarticulated. And if we were to turn the skull around, we would see the bottom of the skull. And there's a couple of structures that I want to highlight from here. So the first thing that I want to highlight is this hole that we're seeing here. That's our foramen magnum, the word coming from Latin and literally meaning a big hole. So foramen magnum is located at the bottom. This is from where the brainstem turning into the spinal cord would exit the skull and then continue as further structures. Other thing that we're seeing here at the bottom that I think is worthwhile to notice are these occipital condyles. These are two bumps at the bottom of the skull on both sides. So interesting structures in that sense to notice. And let's see what else we could see from this diagram. I think we could discuss about parietal bones. And obviously, since it's a disarticulated one for me, it's not as exciting as it is what you see there on the screen. But let's discuss about parietal bones a little bit. So there's going to be two parietal bones. They are separated by sagittal suture running at the mid-sagittal plane. So it separates those two bones, parietal bones, into right and left side. And what we would see, these are separated by coronal suture as well from the frontal bone. So there's another suture for us to pay attention in addition to that mid-sagittal plane or mid-sagittal sagittal suture. Let's see what else we can find on my desk of bones. We can see sphenoid bone. So sphenoid bone is mainly hidden inside the skull, but we can obviously disarticulate it and take it apart. Sometimes described as a butterfly-shaped bone, and I think it becomes obvious when you remove it from its site. One of the things that I do want to mention about the sphenoid bone in relation to future things that we'll be talking about, this is important, for example, holding pituitary gland at the sella turcia. And we're also going to end up seeing sinuses, which are empty spaces within a bone. Within the sphenoid bone, we'll see sphenoid sinus. And we'll talk about those sinuses in just a little bit of a moment. Another bone that I think that we can see and talk from this list is going to be our temporal bones. And there's going to be two of those again, one on both sides at lateral sides. And a couple of things, again, remember mine one is disarticulated. You see it in situ on that nice picture on the screen. But one thing to notice is that we have this little opening for the auditory canal going into the ear. So worthwhile to notice from there. And remember, notice here that the mandible joins to the temporal bone. So we're forming this temporomandibular joint, often abbreviated as a TM joint. And we'll be talking about that a little later. From the temporal bone, I do though want to highlight a couple of processes that are worthwhile for us to consider. So let's have a look of those. So what we're going to see, we have a mastoid process, which is kind of, again, this little outgrowth from the bone, important attachment point for muscles such as sternocleidomastoid muscle. We also see the very sharp styloid process. And we can also see the zygomatic process coming out that's going to be then forming for us the zygoma going towards the cheekbone. Here we're seeing inside the cranium, and I just wanted to highlight those few structures. So there's multiple openings for various vessels, nerves to pass through. We can really see those structures above the nasal cavity that we discussed earlier on. In terms of that, we're seeing the foramen magnum as well, nicely prominent, large hole there. So we discussed about those crystallically cripiform plate earlier on. So I think that those are nice to see there. And we can also see the sella thurcia there. And I've labeled also the foramen magnum, although I think that that's an easy one to spot. So now that we've had a look of a bunch of bones of the cranium, let's have a little bit of a look of the sutures of the skull. And sutures in adult skull are going to be immovable, so they become interlocked joints where the bones of the cranium come together. And there's going to be 4 for us to consider. So we're going to see our coronal suture. Coronal suture separates the parietal and frontal bones from each other. We're also going to see sagittal suture, which separates the right and left parietal bone. We already touched upon that. We're going to see lambdoid suture. I think we mentioned that as well, separating the occipital and parietal bones, and even continuing a little bit at the temporal bone surface there. And finally, we do have squamous sutures separating the temporal and parietal bones as well. So, like I said, those do become interlocked and very, very immovable in an adult. But during early development, we do have a chance that, for example, during childbirth, for some of these sutures to slide past each other so that we can really squeeze that head through that opening of the pelvis. This is not part of the actual learning material, so I don't want you to worry about it, but I thought that it was an interesting anatomical oddity to mention to you. Often students end up thinking that anatomy and physiology are really black and white, as textbooks may sometimes make it seem, but there's a lot more variety that we'll see. So I wanted to talk about sutural bones real quickly. These are small, irregularly shaped bones within the sutures, and we're not really clear about their purpose, but we do know that certain conditions are more associated with these. So an interesting anatomical oddity. Not everyone's skull is gonna be as symmetrical or as similar from one individual to another. So an interesting thing to note. Let's return back to the learning material and to the bones of the skull, but this time we're going to focus on the bones of the face. And for the bones of the face, there's 14 of those that I want to talk about. So let's review those together. And we're going to start actually with the inferior nasal concha. And there's going to be 2 of those, one on each side. So these are those ridges that you find inside the nasal region. And we'll get to talk a lot more about these ridges when we get to the respiratory system. But their role really is we describe them sometimes as turbinates, which explains their role, kind of helping for the air passing through this nasal cavity area to rotate, so create a turbinate in the air that flows past. Other bones that we could mention lacrimal bones, palatine bones, and vomer here. So these are all small bones of the face. And let's start with palatine bones. So these can be incompletely fused as part of development. So we would see developmental disorders where this fusing is not complete, for example, in patients who might have cleft lip or cleft palate. In terms of the lacrimal bones, the word lacrima refers to the tear. So think of the lacrimal gland, the tear gland located. So that might help with locating it as well. And obviously we have vomer at the nasal septum as well. Next thing that I wanted to do, I wanted to talk a little bit about the mandible, and this is the largest and strongest bone of the face. And if you look it down from the top, it's kind of a U-shaped bone. So a useful one for us to look at. On the slide, you're going to see this lateral view of the mandible, and we'll use that to review a few different parts. So like I've mentioned in the past, just knowing the bones themselves is not always enough. We often do need to know, in addition, different parts of the bones. And I think a mandible is going to be one particularly good example of that. We want to appreciate the different parts of it. So let's have a look at the parts of the mandible. The first one that I want to mention is the angle of the mandible. This is especially prominent often in men, not necessarily so much because of the bony structure, but more of because of the muscles that attach there, and those muscles can grow really prominent. So that's one part to notice. In addition, I do want to mention our crinoid process. So crinoid process is the more anterior one of the two superior ends of the mandible. This is an insertion point, for example, for temporalis muscle. I also do want to mention the condylar process. This is the more posterior one of the superior ends of the mandible. And this is what contributes now forming that temporomandibular joint that I mentioned before. And notice the temporomandibular joint is not a very good bony fit. So in some people, jaw might have a tendency that it doesn't quite stay in place, and it tends to fall off from the socket easily if the muscles are not strong enough to hold this joint together. And I would happen to be one of those people. So I often have to be a little bit more mindful about that, especially if I'm opening my mouth super wide. And obviously from the mandible, I also wanted to mention the body, which is the major part that we're seeing here. Continuing with the mandible, let's have a little bit more of a look of a portion known as our alveolar processes. This is the part of the bone where the sockets for the roots of the teeth are located. And what we end up seeing in patients who do not have any teeth, because there's not that stress, and remember we discussed about the stress of the bone, how it's important for maintenance of that. We're not exposing that stress to this alveolar process region with those roots of the teeth. So this bone will start to wear off or just disappear. And as a result, often people who have lost this portion of the mandibular bone, the face seems almost like it would have collapsed. And we can prevent that either with dental work, ensuring that we have those teeth there, or an alternative for those, or even with the dentures. So that's why sometimes I do need to have discussions with the patients about the importance of wearing those dentures, even if they are uncomfortable or they don't just see value in that. That prevents that bone loss of the alveolar processes. We do have a couple of little holes, and they don't particularly well probably show up on this small scale, but they do show up on your diagram. And I want to start with the mandibular foramina. We do have here at the medial aspect of the mandible this opening where the nerves run. So an interesting one to notice there. And in addition to that, we will have a mental foramina, which is for the nerves and blood vessels to run through the anterior chin aspect of the mandible. So quite a few different parts of the mandible, and I think that that's really starting to show us the fact that just naming the bone is not quite enough for us for what we're trying to accomplish. Two different other bones of the facial bones. Let's talk about maxilla. And maxilla is going to be, I do have an example here. The portion right above the jaw, that's forming the majority of the facial skeleton. Within there, we can see things like palatine process that forms the palate. So this layer that separates, or this portion that separates then the nasal cavity from oral cavity, the bony portion of that. And we also will see sinuses within maxilla, those empty space within that bone. I don't have an example because it's such a small bone here out of a nasal bones. These form the bridge of the nose. So remember, the most anterior part of the nose is going to be cartilaginous, but higher up here at the bridge, that is a nasal bone. So you can, of course, fracture that, for example. And finally, and again, I don't think I have examples out here, but you can see it nicely on that diagram, are zygomatic bones, the bones that form the cheekbones. So some people have more elevated, more higher cheekbones, some have less, that will contribute to the appearance of the face as well. So I've mentioned on and off a few times now, as we've been discussing about these facial bones, sinuses. So remember, the word sinus refers to an empty space or a cavity within body. So paranasal sinuses refer to these empty spaces within the bones of the skull, especially around the nasal area. And they are always named after the bones within which they are found. So interesting structures worthwhile to consider. And that really brings us to wrap up the discussion of the skull bones. I know we've spent quite a bit of time on that, but I think that that only emphasizes how important these bones really are and how much there's going on. So make sure that you spend some time with the diagrams, models, whatever you have available, to not just see them on a book or on a video, but actually really appreciate them, whether it's coloring textbooks, whether it's looking at the actual models. Remember also that our Learning Center offers you a chance to go and see a lot of those models. If you go there, they will have the same models that I would have in a classroom. So you do have that resource as well if you want to study outside the class time. I'm just simply quickly going to mention the bones of the inner ear, as we'll get to talk about these much more later on when we look at special senses. But our malleus, incus, and staples, those are responsible for our hearing process. It's very, very small bones located there within the inner ear. Definitely worth of paying more attention, but I think that it really nicely highlights that not all bones are these massive big ones that we see. They can be very, very tiny, but serve a hugely important role. Before we much further in our review of the axial skeleton, there's one particular part of axial skeleton that kind of works as a nice in-between portion that I do want to mention, and I want to mention quickly hyoid bone. What makes hyoid bone interesting that it's one of the very few bones in your body that does not articulate directly with other bones. Rather, it's held in place by soft tissues. Hyoid bone serves a purpose of providing us a site for attaching the tongue and neck muscles. And even though this is not something I would expect you to know in an exam, I often talk to my students about the forensic role of the hyoid bone. So sometimes when someone gets strangled, the hyoid bone can get fractured. It's not always the case, so it's not a definite clue, but it's something that we would definitely look for in a forensic setting. And that brings us now to move our review of the axial skeleton from the skull to discussing the vertebral column. So let's have a look at the vertebral column a little bit and discuss that a little more. So vertebral column, or also sometimes known as our spine or spinal column, serves a few different important functions. First of all, I want to mention that it transmits weight from all other structures of the area that are attached to them, and then passes that weight to the hips. so that we can carry it further to the legs and to the ground. We see also with the vertebral column protecting spinal cord, this continuation of the brainstem, and it runs inside this protective column. So clinical relevance for this protection of the spinal cord, we would obviously see in the patients where we have had a spinal injury. So that would be something to keep on mind. And final function that I've highlighted here is that also vertebral column serves as an attachment point for ribs and many muscles. As we get to the muscular system, you really get to see that. The bone type per the classification of the shape of the bones that we see for the bones of the vertebral columns is of course going to be irregular one. So that's a good one to remember from that, drawing those connections between parts of the lecture material. So vertebral column is made of 26 bones that can be divided into 5 different regions. And let's start with cervical vertebra. There's going to be 7 of those, and the 2 top ones are especially interesting for us. Atlas, allowing us to do this movement, yes, with our head, and axis, the second one from the top, allowing us to do this no movement of the head. Then we're going to see thoracic vertebrae. These represent are formed from 12 different bones, and this is where the ribs attach to. We're also going to see lumbar vertebra, 5 different vertebra, 5 different bones that make up those at the lower back region. And finally, we have our sacrum and coccyx. Sacrum is in adult, 1 single bone, but it does start early in the development as 5 different bones that then fuse together as a process of ossification takes place. This is really the sacrum, the portion that attaches to the appendicular skeleton. And finally, we have our coccyx, again in adults, 1 single bone, starting as 4 bones during the early development, forming our what we can describe as a tailbone. So sometimes my students ask, how do I remember these? How many of each of the bones we have in each of the regions of the vertebral column? One tip that I've shared is considering meal times. At 7 you eat breakfast, 12 noon you eat lunch, and at 5 you probably eat dinner. So maybe that'll help you. If not, you can totally ignore that. I did want to unpack the vertebral column a little bit more, and I wanted us to look at the curvatures of the vertebral column. So we do have normal curvatures that develop as the baby learns first to lift their head up and then lift their upper body when starting to crawl and eventually stand up. We initially start as this kind of C-shaped curvature of the vertebral column, so that process has to take place in order for those curvatures to develop before the baby can then eventually end up standing. We can have some clinical conditions where we have abnormal curvatures that develop as well. So we'll see some of those examples a little later. I do want to also highlight these fibrocartilage discs between the vertebrae. So these are these cushion-like pads, and they offer 2 purposes really for us, serving 2 purposes, offer us a greater range of mobility, so we don't get this bone-on-bone interaction, which would really limit our ability to move our vertebral column, but allows really this bending of the vertebral column. The other thing that these intervertebral discs do, they provide us serve us as shock absorbers, so eliminating stress and impact from if there would be otherwise a shock that could result from the physiological movements, jumping, things like that. Obviously, the intervertebral discs, in a clinical consideration, one thing to keep in mind is that they can get damaged. We can develop a herniated disc, which is basically a disc that bulges out from its place. And one of the issues that we see with these is, in addition, that they might end up pinching a nerve of a patient. Finally, in terms of the vertebral column, I'm showing here a couple of examples of abnormal curvatures of the spine as an example of scoliosis, sometimes known as, in layman's language, hunchback. We see on the left side of the screen really nice x-rays pictures with and without some metal bracing that sometimes is used as a surgical intervention to try to help these patients with the scoliosis. And that brings us to the final part of the axial skeleton that I want us to look at, which is going to be our thoracic gauge. And let's unpack that portion a little bit before we wrap up this video. So we're going to see that thoracic gauge, the bony parts that we're going to be talking about, is going to be our thoracic vertebrae. There's going to be 12 of those, as you remember, and our sternum, which is basically the chest bone. In addition, we see ribs as the lateral borders of the thoracic gauge. Even though it's not really a bony part, I do want to mention the costal cartilage that attaches the ribs and sternum together. So this is not full-on bone. This is actually cartilage that serves this connection for us. In terms of the functions of the thoracic gauge, we see a few different functions protecting vital organs within this space. So heart, lungs enclosed inside there. Also supporting the shoulder girdles and the upper limbs, and providing many attachment sites for many muscles that we have. So let's unpack these structures a little bit more, and let's start with the sternum. So sternum can be divided into 3 regions. We have the body, which is the largest area, the mid part of the chest bone. We have our manubrium, which is the superior portion. This is where the clavicles or collarbones attach to. And finally, at the very bottom, we do have cyphoid process, which is the inferior portion. And in some patients that can be missing. In some patients, it could be pointing to the wrong direction. And if it's pointing in a way that generates a risk for us, that could be something that we might want to consider to address. But normally, in most patients, not much of a concern for us. Let's talk about ribs next. So there's going to be 12 ribs pairs in total. So 12 ribs on each side, each of those forming a pair, 10 on both sides. And we can divide them into true and false ribs. So we're going to have 7 true ribs. And the reason why we call these true ribs is that they attach directly to the sternum through that costal cartilage. And our false ribs, there's 5 of those, ribs 8, 9, 10, 11, and 12, that do not attach directly to the sternum. The ribs 8, 9, and 10 actually attach via costal cartilage to the 7th rib. As you can see on that picture, I've highlighted this structure. And from the false ribs, we can separate a subgroup of 2 further ribs, ribs 11 and 12, which are our floating ribs. Like I said, they are included in the false ribs. The reason why we call them floating ribs is that they do not attach to the sternum at all. And sometimes we see some interesting things in social media and other things. Some people have tried to remove those to get a smaller waist and so on. I would really encourage you, if you have a bone in the body, probably it is there for a reason, unless it's some sort of an abnormality. So I don't know. That really brings us to the end of our axial skeleton. I think we've done an incredibly good job covering a lot of ground on this video. So I'm going to end this recording here. And on our next video, we'll finish off by talking about the appendicular skeleton. Thank you again for joining me. I look forward to seeing you at the next video.